name is Siobhan Nunn and I'm the Principal Social Worker for CHO7 for Safeguarding, and I'm going to be your chair this morning. I'd like to welcome you all here to the Ashling Hotel to the first Learning and Development Seminar for Safeguarding Facilitators. You are a multidisciplinary group from many different organisations who have shown great commitment to the protection of vulnerable adults, and I'd like to thank you for that commitment and dedication. I'd like to welcome our speakers who have travelled from around the country, and particularly to Professor Michael Preston-Shute, who has come here from the UK. I would like to welcome and thank my colleagues from the National Safeguarding Office who have organised this event today. And finally, I would like to acknowledge that there are two of our colleagues who are not going to be with us today, and they are Anne Wall and Frank McHugh, both who passed away during the summer. I would like you to join me in welcoming Martina Quealy, who is going to open today's conference. Martina is the Chief Officer in CHO6, and she's the Chair of the Review Development Group for the review of the current HSE safeguarding policy.
Good morning, everybody. You're very welcome. Thank you, Siobhan. Today is an important learning event with a varied panel and interesting speakers, and I'm delighted to be allowed the opportunity to open today's event and to welcome you all. Safeguarding is everybody's business and responsibility, and therefore we must be as informed and open as we possibly can to new learning and to learning from our own and the experience of others. As professionals, educators and leaders, we have a responsibility to advance our own continuous professional development and practice. Great strides have been made in recent years to address the weaknesses and failings in our health and social care services. And there were failures, and some of those, I think went very deep into our personal and professional psyche here when we bore witness to them. So it is really important, I suppose, to understand those failures, to really understand why they happened, but not to be defeated by them, and to take ourselves forward in a very positive way, that we can strengthen our systems, our structures, and our professional development. As training facilitators and champions of education among our staff, you play a vital and central role to that task and target. The commitment and enthusiasm you bring to the training role is critical to advance the culture and ethos of a service where safety, welfare and dignity and respect for the human rights of our service users should always be paramount. Later this morning you'll hear about the development of safeguarding training, the quality assurance process, and the National Safeguarding Office will update you on the interesting statistical information relating to training. The quality assurance framework development is a vital development and a key part of the agenda for today and for our services going forward. The quality assurance process is necessary to assure that the training is being delivered in a consistent and to a sufficiently high standard. Now, training of itself isn't the end, but it is one of the key drivers in terms of getting to the point we want to get to. One of the key drivers for a sustainable, quality-driven approach to workforce learning into the future. The programme today will also give an opportunity for you to hear and share experiences with practitioners and training facilitators and colleagues from around the country, and that's really important. There'll be presentations from Cork, Mayo, the Midwest, and that will give us an opportunity to reflect on our own practice, to hear examples of interesting positive initiatives that have happened around the country, and obviously I know this is part of what we need to do as well, is to explore some of the struggles and challenges people experience in their practice all the time. This isn't simple work, it's quite complex, and I think any of us who manage in the system understand the complexity that you're facing in terms of making safeguarding personal. The programme will also give us an opportunity for the National Safeguarding Office to update you on the development, on the safeguarding development group that I've been sharing since January. Your feedback as practitioners in terms of our learning as a review group has been absolutely essential. And I'm really interested in any of the events we've had to hear what your experience has been, and indeed yesterday was really interesting. Your feedback as practitioners and training facilitators is very useful in that analysis. And in informing the future policy, we're at a unique point where we are now shaping a new policy. And that is really important, because the current policy we have, I think, came in when there was an urgency among all of us that we needed to do something really quickly to try and prevent harm. And the policy, everyone I think has said, you know, there are flaws in it. It's not a perfect policy, but nevertheless, the policy has been really important. But we now are at a unique point where we can reflect, where we can give some deep thought to what's right and what's wrong with the policy, where the challenges lie based on your experience, particularly as practitioners and trainers, and that the policy we're writing will be well informed by your experience and indeed by the experience of others. As a chief officer and chair of the review group, I've seen at first hand the difference that having a safeguarding policy and indeed a safeguarding team makes to my own area. I don't think Frank is here today, he was here yesterday, Frank McCusker. And I don't want to overemphasise it, but I have to say it has been a huge benefit to the area. Leaving staff to deal with the complexity that they deal with in safeguarding issues without a clear policy and without a specialist team, it really just doesn't work. Those supports of a clear policy, good framework and good professional support where you continue to develop your learning and understanding are absolutely critical to success. There are many areas that need to be improved and strengthened, and I'll be the first to acknowledge that. Yet in spite of many challenges and obstacles, I believe we've made significant progress, and I really look forward to developing our services further. I'm delighted that this seminar will be, there will be a keynote presentation this morning from Professor Michael Preston-Shute, and I had the privilege of hearing the presentation yesterday, which was most interesting, so I won't give away anything, Michael. Michael has had a long and distinguished professional and academic career, as you'll see from your notes. He'll address you on the topic of making safeguarding personal. In spite of many challenges we face in the Irish health and social services, we've a real chance now, as I said earlier, to reflect on our own experience, but also to listen and reflect on the research and evidence and experience of our near neighbours in the UK. Where they've been on the journey a little longer than ourselves. So making safeguarding personal aims to develop an outcomes-focused approach to safeguarding work and a range of responses to support people to improve and resolve their circumstances. This opportunity is most timely. And just in relation to where we need to get to, making safeguarding personal is, I think, the most important element in relation to what we're trying to do. And although it sounds very simple, keeping the person at the centre of our decision making, to be honest, unless the focus and the system we have in place actively pursues that goal, we will find we're driven by other forces, not necessarily the person at the centre of our service. I'd also, in my address, like to compliment and acknowledge your work, your significant contribution as trainers and safeguarding team members to advancing the safeguarding agenda. I mentioned Frank by name, that's because he's the man in my area that when something gets rough, but all of you share that responsibility in your own respective areas. The introduction of the vulnerable person safeguarding policy and the rollout of the safeguarding teams has been a critical development. And research and experience tells us that to undertake effective change management in this area, there needs to be a critical mass of training and capacity building. A key message from phase 1 of the safeguarding review policy has been the significant positive impact of training. Training has greatly assisted staff in recognising and in their ability to respond appropriately to concerns of abuse and neglect. And indeed, there is evidence that the training programme has also challenged values, attitudes and behaviours. Over the past 3 years, 169 training facilitators across the HSE and funded agencies have managed to train over 30,000 staff in that awareness raising. This is an amazing achievement. You've built a significant capacity. Your contribution and achievement is a real example of values in action. And as a senior manager in the HSE, I would like to express my deep appreciation on behalf of the organisation to your contribution in that regard, because it is very significant. As I've noted earlier in my address, your training role is critical to advancing culture and the ethos of a service, where safety and entrance of a service user is always front and centre. I'm going to renege on my promise now not to give away any of your presentation. But you will note later when you hear Michael's presentation, the training, of course, isn't enough. And we need to make sure that your efforts as trainers and facilitators doesn't fall on fallow ground. And that's really important for me as a manager, that the systems and structures are in place, that when you as trainers are challenging attitudes, beliefs, providing and building that capacity within our teams, that the organisation is supporting those efforts and that the way it does its business supports those efforts. So in conclusion, to fill you full of hope now, I wish the Learning Seminar all the very best for the rest of the day. I'm really looking forward to your comments and to hearing about your experience, and I'll be here until lunchtime, which is really good, and I'm sure that the presentations will generate constructive engagement and dialogue and debate, which is always very helpful in this regard. So thank you very much.